Hello, I'm Robert Waters, medical doctor, and I want to talk about toxic metals today. You hear about lead and mercury, but what often isn't known by doctors or patients is that there are many, many metals, and together they are impacting our health. These metals include, besides mercury and lead, cadmium, arsenic, antimony, and even elements that are inserted into the human body, like cobalt, chromium, and titanium, in the form of joint replacements and other orthopedic devices. In addition, many people have had magnetic resonance scans, MRIs, in which gadolinium, a heavy metal, is injected as a contrast agent. This metal has been shown to cause fibrosis of the kidneys and skin. And yes, it's unusual, but it does happen, and one wonders whether the small doses could be having impacts that aren't really noticed by the average person. In actuality, the sum of even small amounts of toxic metals in toto produce definite ill health. And there's more and more science being written, investigated and written about small doses of toxic metals and the synergy between these metals, the interaction. And part of it, I believe, is due to the fact that we have systems to detoxify these metals. But if a number of these metals are added in one person at any one time, it overwhelms the capacity of the body to discharge these metals, and they start to affect damage. So what does this damage do? The medical literature supports the case that accumulation of various toxic metals and even accumulation of iron as we age produces changes in our DNA, changes in our proteins, enzymes, and changes in our membranes of our cells that are at the basis of cancer, cardiovascular disease, immune dysregulation, arthritis, osteoporosis. Actually, there's no area of the body that is not affected, and that would make sense because toxic metals do a number of things. One, they cause a spin-off of damaged waste products called free radicals that then damage our cell structures. And two, they insinuate themselves into positions of normal metals like zinc in our enzymes. Now, 3 of these metals have been implicated in particular in brain degenerative diseases, and we're all afraid about Alzheimer's. You probably hear in the press that this disease is becoming more and more prevalent. You're seeing people with this disease earlier, more and more Parkinson's disease, and mercury, lead, and iron itself have been shown in combination to cause neurons to die. So what do we do about this? Well, I've been doing a treatment for about 30 years called EDTA chelation therapy. During this treatment, a solution of an amino acid chelating agent that grasps and firmly binds metals and discharges them through the urine is combined with a number of B vitamins, a high dose of magnesium, vitamin C, and other substances that are infused into a vein, an arm vein, over a 2-hour period. This is not a dangerous drug. As a matter of fact, we have a 50-year history of the use of EDTA, and we have last year the publication of a study of chelation therapy by the federal government called the TAC trial, the trial to assess chelation therapy. We were one of the principal investigators in that trial, and I'm happy to say it documented 2 things. A, that absolutely EDTA chelation is safe, and B, that it is effective, and especially for diabetics. Any diabetics out there, I can tell you that the services we offer in this office, including chelation therapy, are absolutely the best way to handle diabetes. Now, besides the infusion, one should know that it is done in the comfort of our office. You are in a lounge chair. You can watch television or a movie. You can eat, we provide nuts to be eaten to keep your blood sugar up, and you have wonderful conversation, and here in the beautiful resort, Wisconsin Dells. So you could consider that you don't have to be sick to do chelation therapy. In fact, many patients are now doing this preventively because we're all accumulating these toxic metals. And it's just a matter of how much and how fast, and it depends on where one has lived, what exposures one has had. But believe me, they're all there, and we have a way of removing them safely.